This is a panel discussion on early action and mental health. And I'm delighted to be able to introduce Professor Praveetha Patalay, who is in the Lifelong Health and Ageing Unit and has a joint position with the Institute of Education. So a worked example of, I think, health for public cross faculty working, which we're delighted with. I'll ask Praveetha to introduce the panel. Thank you very much.
Thanks, Graham. Hi, everyone. Nice to see you this afternoon. We have a very exciting panel of three people who are going to talk about prevention and mental health. Our first first panelist is Sarah Brown, who is Head of Children, Young People and Perinatal Mental Health at NHS England, so somebody from the policy side. Sarah is the National Head for Children, Young People and Perinatal Mental Health at NHS England, and she provides strategic leadership across policy, commissioning and system transformation, drawing on over 20 years' experience in public sector children's services. Her work focuses on strengthening prevention, early intervention and community-based mental health support, and is... Did somebody say something? Sorry. Can everybody hear me at the back? No? Okay, I will try to be better at projecting. She is committed to reducing inequalities and improving the outcomes for children, young people and their families, and collaborates across government, health, academia and the voluntary sector to expand evidence-based services and advance equalities. Is the volume better now? Yep. Perfect, thank you. Our next panelist is Professor Jess Deighton. She's Professor of Child Mental Health and Wellbeing at UCL and the Anna Freud Center, and she's Director of Applied Research and Evaluation at Anna Freud, and Director of the Evidence-Based Practice Unit. She's also Director of the Growing Up in the 2020 study, which is an adolescent cohort commissioned by the Department for Education. Her expertise is factors that promote or undermine resilience in children and young people, the evaluation of interventions to support mental health and well-being, particularly in education settings, and the interplay between mental health and educational outcomes. She has carried out some of the largest trials and research projects in mental health and well-being of young people in the school context in this country, including leading the DFE-funded Education for Wellbeing program and the National Lottery-funded Head Start Learning program. And she co-leads the research program for Be Well, which is this large study of school children across Greater Manchester and many other parts of England. I also should say, Jess and I go back my entire career. She was one of my PhD supervisors. And our third panelist is Dr. Gemma Moore, who's Associate Professor in Health, Wellbeing and Communities at UCL, and at the UCL Bartlett School of Environment, Energy and Resources. And she's an applied social researcher, and her work focuses on the intersections between people, their environments, and decision-making processes. Her research integrates engaged learning processes into large, complex transdisciplinary programs focused on health, sustainability, and the built environment. She's also the program lead for the MSc in Health, Wellbeing, and Sustainable Buildings. And between 2022 to 2025, she was a faculty lead for Impact. And we're really excited to have this nice mix. So Gemma really representing sort of built environment, wider environment, Jess with her expertise in education and resilience and the school system, and Sarah with expertise in NHSE. So very excited to have this panel. Are all of you please going to come and sit here? So, and I will, yeah. So the way this is going to work is, so we're going to have a few questions that I've prepared with the help of the public team in advance, just to get the conversation going. And then we're going to ask you for questions, both online, if online people can hear me, and here on the floor. So while they're speaking, think of questions you might want to ask them. And yeah, we can start. My first, just for fairness, I'm going to start, with each of my questions, I'm going to ask it to a different person first, so some different person can get the first word in. I'm going to ask my first question to Jess. So the health of the public approach we're discussing today emphasizes the importance of structural and social determinants of health. What system-level changes would deliver the greatest improvements in population mental health if implemented through policy?
This feels like a lovely gift to be able to try and answer these questions. Can I just check? I can't tell if the microphone's on. Can everyone hear me okay? Brilliant, thank you. I think I'd start from saying, I think recognising that prevention of mental health problems involves just that. It's a systemic problem. It requires systemic change. And I think that's easily said and is often acknowledged, but the implications for that don't often percolate through. So that means we need shared responsibility and collective action across a whole range of sectors and contexts. And sometimes those aren't the obvious contexts, but actually what I think unfortunately happens is not that. What happens is there's a kind of a diffusion of responsibility for mental health, where it's the sort of hot potato that gets passed around as, oh, well, that doesn't sit with me, it's a wider systemic issue, so how can we possibly solve it in this context or that context? I think we should absolutely flip that and say, yes, it's a wide systemic problem, so how are we going to tackle it in each context? So that's the starting point, I think. And for me, a lot of my work is in schools, so that's probably where I turn first, because good preventative work is going to start in childhood, I would say. And it's such an important opportunity for us to embed resilience, to embed positive well-being, and to recognise where young people are beginning to struggle, and to put that sort of early support in place. So it's really important that it's a context that we focus on. I'm aware that schools often feel like their remit is crammed already, and I do hear that. So it's not about asking for teachers to become the mental health expert, but it is asking them to become part of that wider workforce that is the support for young people that they need. And it's also approaching each setting, but in schools I would say absolutely it's about first doing no harm, so thinking about what are the elements of the school structure and the way that school works and its ethos that actually can undermine mental health and well-being first and foremost. So we know from young people that they say they find it an increasingly pressured environment, so that can be high stakes testing, but it's also just generally the approach that's taken. It can feel quite draconian at times, and there's a lot of sort of behaviour management which is done through sanctions and things, which sometimes absolutely are needed, but there are occasions where opportunities to build a more relational approach and build social connection, a sense of belonging might be a better starting point. And also, just taking that well-being lens to all policies within schools and the practices around them as well is really crucial. So that's the kind of bedrock, if you like. And then it's about layering up what you can layer up in the school. So evidence-based, please, approaches. There's a lot, I would say, of what I keep calling the shampoo ad interventions in schools, which are, here's the science, and it's very loosely based on evidence, but actually it's not a tried and tested approach, and schools are being pushed these things without a way to discern what's the good thing to do. So I think we need to build capacity in schools to commission evidence-based support, to do the evidence-based thing, and some of that support needs to come from that wider infrastructure like mental health support teams who do great direct work with young people but would be in a brilliant position to build capacity in schools. And I hear mental health support teams doing brilliant work like that anyway. And then it's thinking about that wider expertise that sits around the school as well, like mental health support teams, but if we see some of the sort of expertise at hand that might be coming in through the SEN review, trying to think about how we combine that support and join it up. So for young people, they're not going through different systems to get different kinds of help, when for them it's all part of the same challenges that they face. So I think that's really crucial as well. And just trying to link schools up with those wider systems. I'm probably talking too much now, so I should just stop at schools and let others talk about some of the other contexts.
Who wants to go next? So the question remains, what system-level changes do you think would deliver the greatest improvements in population mental health?
I'm just going to check that that's on. Yeah, I'm Sarah, by the way. We didn't actually kind of...
yes,
that's Jess. It's Gemma. We didn't make ourselves known. I think, first of all, to say we have to have a whole system approach to prevention of mental ill health in children and young people, and then across the life course. One of the things that I wanted to just touch on first is the fact that people may have seen earlier this month the interim report from the National Review into mental health, autism and ADHD published initial findings. And I know, Jess, you're heavily involved in that work as well as many colleagues are have been involved in. And one of the really important things that piece of research has shown is that this increase in mental ill health is real. That's been debated a lot. We've had the last robust prevalence survey was undertaken, or the last full prevalence survey was undertaken in 2017, and then there have been follow-up surveys that were undertaken during the pandemic, smaller cohort sizes over the time because they track the same cohort going through. So there's been much debate about whether actually this massive increase in mental health needs is real. The initial findings from the prevalence review are categorically yes, it is, but it's really complex in terms of understanding what the drivers of that are and what the changing presentations are as well. One of the things that I was really struck with is the changing way that distress is presenting, and particularly in young people, and the fact that what we're seeing coming through more is much more emotional distress. It used to be that distress came out in older cohorts in sort of midlife, but what we're seeing now is a lot of distress in children and young people around loneliness, around emotional distress, around school anxiety, also around kind of the environment that they're living in. There's a whole range of different factors that are causing children and young people distress, and I think that really speaks to what we're seeing when we go out and speak to children and young people. There's not one single thing that's driving this increase in demand. The Young Futures Foundation published some research last year which said about the decline in sleep. I think sleep was also found in the prevalence review. That declining sleep quality in children and young people is a factor. We touched in the previous session very briefly on social media and smartphone use. Young Futures Foundation have seen evidence of that impacting, which probably isn't a surprise. The precarity of the environment around employment and the kind of security of jobs and employment post-education. And also children and young people reporting the lack of a third realm space. They didn't use those words, obviously. But the lack of play facilities, of youth facilities, of things that happen outside of school, things that happen outside of the family home. And I think that really hammers home why it is really important. The NHS has a role to play, and obviously, working in NHS England, I see that as my primary focus. But one of the things that I thought was really important when the 10-year plan came out last year, it was a plan for health, not a plan for the NHS. And I think that that's a real seismic shift, because we're not seeing the health of the nation as solely the responsibility of the NHS. The NHS has an absolutely critical role to play, and actually I thought it was really important the fact that the 10-year plan talks not just about the role of the NHS in secondary care and specialist care, but it calls the NHS out on its responsibility around secondary prevention. And I think the MHSTs, the mental health support teams in schools that Jess talked about, is a fantastic example of how the NHS and other sectors can work collaboratively together to better support children and young people where they are. Department of Health and Social Care are currently funding a number of pilots of early support hubs around the country. So this is working with the voluntary sector, with the youth sector, to be able to provide support to children and young people within their neighbourhoods, within their communities, working through kind of youth engagement-driven methods of intervention, where the mental health element might not seem to be the primary purpose, but where the mental health benefits are absolutely realised through that relational and engagement-driven approach. So I think we're starting to see emerging evidence of how this work can happen, and I think it sets us in a really good position for the work over the next 5 to 10 years, and on the back of what we see coming out of phase 2 of the prevalence review.
Thank you. Gemma, same question for you.
Yeah, thanks. Hi, everyone. Can you hear me okay? Great, okay. I can just support what you said about the need for cross-sector integration. That is key for tackling, as you say, a system-wide approach and the issue. My perspective comes from the built environment, so picking up some of the points that you've raised, I think we can't ignore that neighbourhood infrastructure that exists and the role of the social infrastructure within the neighbourhoods, including parks, youth clubs, libraries, and how the importance of those spaces to build social connection and how that's key for young people's well-being. And I was involved in some research with our Department of Psychology here at UCL that looked at young people's sense of loneliness, particularly young people living in deprived areas where a lot of those facilities are either being closed or reduced in terms of quality and investment, particularly in green space and the public realm. And so we did some work with young people in these neighbourhoods to work out what is it about those places, or where do they find connection, or where do they feel also most lonely and disconnected, which was really revealing around the importance of those third spaces to build social infrastructure. And particularly in deprived neighbourhoods where there is an influence of geography, like your neighbourhood becomes really, really important to you and you're looking at that hyper-local scale. And so most people's social capital is at that very small scale. The other thing to pick up about that was also this sense of agency over their built environment and what they can do. And on the MSc that I run, we've just been working with the brilliant design agency called Matt and Fiona, who focus on youth engagement in designing built environments, both large-scale neighbourhood interventions, but also very small-scale. And they've just been involved in a big project in Essex of a new town development where they've got the next generation involved in making those decisions about what places are needed to build those connections. And part of that has sort of double benefits, understanding the needs of young people, but also building the capabilities and confidence of those young people to have a say in their built environment. So I completely echo the point of like the engagement being really, really important, the integrated system level approach, but also not forgetting the everyday environments, like school is everyday environments, but that everyday environment of the public realm, which are really, really key for those social interactions that can combat things like loneliness and other aspects around well-being.
Thank you. I'm going to ask a follow-up before we go to our next question, which is around inequalities. So partly, as we've all discussed, options for where things can change, but Gemma, as you flagged, often when the solution is things like better infrastructure in the community, better infrastructure in school, we know from existing evidence in other spheres, such as smoking prevention and things, that actually the benefits are disproportionately potentially felt by young people in higher income or better, higher SES neighborhoods. So I suppose what do we have to be thinking about now when we're talking about these things to make sure the benefits of any sort of preventative efforts for young people's mental health are felt across all groups, including and especially the most disadvantaged young people? Anybody can take this. Whoever wants to take it can take it.
We're all being polite. I'll have a go. I mean, I would say this, wouldn't I? I think as researchers we have to do better at embedding this within our evaluations and our research as well. And I say this because Praveetha and I have managed to embed this in some of our research, but it's really important when we're evaluating interventions and when we're developing the evidence base that we are intentionally looking at whether there is a differential impact of the things we're exploring on different groups of young people. So, and that work is always necessarily exploratory, but it's really important that that is there for people to make use and make sense of. So, for example, in Education for Wellbeing, which was the big trial that Praveetha mentioned, I had been leading for felt like a very long time for the Department for Education. We were looking at whether there were differences of impact for young people with free school meal eligibility, for those with special educational needs, for boys versus girls, and we did find definite differences. So I think we have to be really intentional about that. And given that one of the things we haven't sort of named specifically so far is, inequality is one of the huge things that we really need to tackle. We know that the drivers, some of those are key drivers. We need to make sure we don't amplify and increase those inequalities with the interventions that we do recommend. So I would say build an evidence base first, would be my initial response.
Absolutely, I would completely. There we go, it's picked up. I completely agree with that. One of the things that we've been looking at is around prevention. We kind of touched on it, that the evidence base isn't there in the same way as it is. You know, you don't have the same kind of burden of proof, you don't have the same kind of randomized controlled trial type setup for some of these more preventative interventions. We're starting, actually, Daisy Fancourt at UCL has been doing some work around creative health. There's been work at the Anna Freud with the Advantage programme around mentoring through the community arms of professional football clubs, bringing together mental health and a kind of community action. But I think that there's a real disparity in the way that we are holding kind of medical interventions and community interventions to the same burden of proof that we really need to look at. And I think University of Oxford have been doing some work around this as well, because what my worry is, and as you said at the start, I've been working in children's services for nearly a quarter of a century. I've been working in children's mental health since 2010, and I'm still hearing the same thing from children and young people about the systemic failures of the system that offers support to them now that I was 16 years ago. And that's a professional embarrassment. Because we're not valuing the voice of lived experience. And who are the children and young people whose voice we're not valuing in terms of their experience of community-based, asset-based, relational-based care? It's children and young people who are some of the most marginalised in our models of support. So I think there's an inherent inequality in the way that we are capturing that experiential aspect of the impacts of care in the way that we look at gathering evidence. And I think it's on us all to think about how can we address that in the methodologies that we use, in the way that we value research, in the way that we construct research, that able to give appropriate weight to that voice of lived experience in the work that we're doing.
Thank you. I'm going to follow on to the next question, which Gemma, you get to go first, which I think leads on nicely from Sarah's point, which is prevention. Although we talk about it a lot, it's harder to sell to policymakers because often it's harder to see and to measure, and the benefits are longer term down the line. How can we better highlight the benefits of prevention and need for more focus on prevention and mental health? And how do we overcome this problem that is actually the thing you prevented from happening is it's harder to say, actually, we've prevented this many young people from getting depression 15 years later than saying this intervention, cured X amount of people from depression 6 months down the line.
Yeah, thanks. Thanks for the question. When I saw your question, for me, it came back to that question of what do we measure and what are we counting and who decides that? And ultimately, does that influence what is funded in terms of, I guess, setting the priorities when you pick a particular metric to measure or collect evidence on? And I guess some of the metrics around mental health and well-being, and particularly the work that I'm involved in, goes back to things around sense of belonging, feelings of trust, feelings of control, confidence and agency, which can be seen as really hard to measure and to count. And particularly if you're thinking about these issues that are systemic, they're long-term, they're interconnected, it presents a bit of a challenge around this idea of what to evaluate. And the work that I've been involved in on the Evaluation Exchange, which is a programme led by myself, and I think Ruth is in the audience, Ruth Unstead-Joss over there. Our work looks at questioning what is evaluated on a range of different topics, and we promote an approach to evaluation that uses different types of methodologies, particularly participatory and creative methods. And a lot of our work is actually with the voluntary sector, building capabilities and capacities for them to collect the data at that hyperlocal level, and for them to set the agenda around what they can count and measure and how that is used on the ground to influence the interventions. And we've just been involved in some work around providing some support with the Common Ground Award, who have come to us to talk about how do we evaluate social cohesion at a national scale after providing lots of grants, again, looking at providing grants to provide facilities and spaces for people to connect. And their ask has been around, again, upskilling and working with those voluntary sector organisations to build capabilities there to evaluate what they're doing, because this isn't just about evidence being collected by researchers and by policy and then directing what happens. Actually, the whole system needs to involve those on the ground delivering it and questioning the data that does exist. Like your point, Sarah, like the data can and should involve stories, lived experience, and that has to hold the same weight as other forms of data and information.
Does anybody else want to?
I can add a bit more. I suppose, yeah, we all know the obvious examples like Sure Start, where, yes, we found out many years later that it was incredibly effective in many, probably more ways than we had expected, but it took a long time for that evidence to accrue and for those for the right outcomes to sort of come online, if you like. So I think there is there's sort of a sense of needing to have patience, but also trusting the evidence that we do have that demonstrates really well. Yeah, of course, it's logical that it costs a lot less to treat someone in the community than it does in a clinic or certainly as an inpatient. So that all makes good logical sense, and we've got, we're building an evidence base. It's definitely got gaps. But I think the other thing is building on what Gemma was saying about a question of measurement. So not just, measuring those things that feel at the time are going to show the benefits, but actually I think we have to get much smarter at thinking about prevention beyond the silo that is our lens of focus. So we have to move outside our mental health comfort zone and say, actually, when you look at prevention, when you look at the drivers of poor mental health outcomes, I mean, there is some specificity, but they're the drivers of poor physical health outcomes. They're the driver of poor educational outcome. They're drivers for NEAT. They're drivers for all sorts of things. So a good preventative intervention that's going to give you bang for your buck tackles those drivers and measures all of those outcomes. And we should be shifting to a mentality of what are the interventions that if we put them in place, they don't have to have mental health written on the label. Like you were saying, sometimes they're not. There's something that looks very different. But what we want to know is, of those killer outcomes that we know are so crucial to young people's development and for later adult life, what are the best interventions we could put in place? And I think that's the lens we have to have. And then there's how do we embed the long-term evidence by linkage to, I know there's people in this room who do brilliant data linkage to administrative data and things where we can take the long view and we can wait for the data to trickle in later on. So we need to be much more joined up in the measurement as well as in the thinking about the system change.
Yeah, absolutely. I was just thinking about it. My background is in commissioning, so I come from, putting the money where the mouth is in terms of, funding services. And I think one of the big challenges is the way that we are kind of siloed in our approach organisationally across government, kind of on a micro level, within kind of local settings, and the fact that we are often working to shared outcomes, but not through a shared approach. And actually, the early support hubs that I mentioned earlier that DHSC fund were actually initially funded by the government's cross-government shared outcome fund. And I think we need to be thinking about this shared outcomes approach much more, much more proactively in the way that we're thinking about, because we tend to get, and I know from my commissioning days, we get hung up on kind of attributing impact to a particular bit of funding or a particular bit, but actually when you're talking about complex systems and getting in early, complex systems like we are in terms of a neighbourhood health approach, we have to think differently about that. And one of the things that comes to mind is the Centre for Young Lives have recently published earlier this year an initial evaluation from their Growing Up Well project, which was in Yorkshire and Humber, and I'd really commend it to people to go and have a look, because what they've done is work with the North Yorkshire and Humber ICB, the Integrated Care Board, and with the local authorities, and they have pooled budgets across across children's spend. So they've looked at discretionary spend across the council, across health. So this isn't funding that goes to schools. It isn't the funding that goes to, statutory funding for children's social care. This is the discretionary funds that those agencies, those organisations have. And they've pulled that. They got something like over £1 billion worth of funding, which they have then invested on a shared outcome framework to take a preventative, child-focused approach. Have a look at it. They're looking at rolling out the model of this kind of highly place-based, child-centred approach to delivering a prevention and early intervention across a whole range of health and socio society kind of outcomes. Do have a look, because I think that's where we've got some real potential to kind of think about how we can do things differently. And it kind of does talk back to Sure Start and some of those earlier models that we saw, 20, 25 years ago, that were doing exactly that. But I think that there is a real opportunity right now.
Brilliant. Thank you, everyone. Actually, I'm going to deviate from the brief and ask if anybody in the audience has questions now. We can take a couple of questions and then go back to, There's a mic coming. We have somebody.
Thank you very much, panel. Wonderful discussion so far. I hear a lot of talk on research, and we discussed that to a great length. I see a lot of talk on recommendations, what things we need to do. But I have a feeling that there's paucity of movement in the implementation space. And I think that's, to me, something that's very striking. I think looking back at all the data that we discuss, there is a lovely interplay of biophysical, biosocial factors, but yet our responses in recognition of these factors is that our structural redesign of pathways seems to be very poor, in the sense that we don't build pathways that inculcate trust of communities and of young people. We don't build pathways that are flexible enough for the needs of our communities, and the structural pathways are devoid of real-world engagement, and that's a real shame. So even the most well-designed services often miss the people that are most in need. So I maybe can suggest to you as a request, do you think we need to look at the inequalities in this space with a new lens? Thank you.
Who wants to go first?
Yes. I think you're absolutely right. I mean, some of the work that I'm doing at the moment is looking at where spend is in the system. And, if we look at the mental health support teams in schools, they account for somewhere like 10, 11% of overall children's mental health spend currently. And, if that's a flagship early intervention, secondary prevention, right at the start, kind of initiative, whereas we've got 30% of NHS funding being spent on kind of specialist and inpatient care, and then the kind of remaining 60% sort of in the kind of CAMS space. It's not exact, because we can't extract, there will be other community-based activity that's funded within that 60%, for example. But, when you're looking at where the investment is, and therefore where the activity happens, it's very much funneled towards secondary care and specialist services. And we need to look at, it needs kind of radical restructuring and also a massive cultural shift to think about how do we flip that system on its head to be able to get the investment at the front end of the pathway and actually make good on the ambitions within the 10-year plan. I mean, not to kind of put weight on Jess and colleagues involved with the prevalence review, but I know phase 2 is going to be looking at recommendations in terms of models of care. We've also got Alan Milburn's review of around children not in education, employment and training. We've got a couple of other kind of big pieces of work that are going on at the moment. We've got, the modern service frameworks, both for serious and enduring mental illness, which is kind of looking at sort of adults, but down to about 14 as well, and also the children's modern service framework, which the call to evidence on that has just closed last week. We've got some big hitting kind of policy drivers that are going to come through later in the summer and in the autumn, and I think that that's the real opportunity to be able to get some traction with making the kind of shift that we really need to see in the system.
Anyone else in the audience want to?
Hello, testing. Hello. I was just curious, kind of an open question for all of you when we discuss the importance of evaluation. I work in a lot of mental health evaluation spaces and just kind of dealing with the balance of working with community-based interventions, but under a very restricted grant evaluation framework. So just navigating how you meet these kind of parameters of IPPs that are in the structure base that you have to report to your GPO versus what is actually happening in the community-built intervention. So I'm wondering if you just have faced this and how do you navigate it?
Can I ask what IPPs and GPOs are, please?
Huh, sorry? Oh, sorry, I'm using, I work for American grant funders, so maybe the GPO's grant officer, program officer, and IPPs are very similar to SMARTY objectives, kind of yearly, quarterly goal reportings, if that makes sense, sorry.
Thank you.
I don't mind having a go. Thank you for the question and sharing your experience. Again, from the work that Ruth and I are involved in on the evaluation exchange, sometimes we meet with very small community-based organisations, and they show us what data they're collecting, and we ask, well, why are you collecting this? And a lot of the time, they don't know, and it was at once maybe a funder had asked or multiple funders asked, because lots of those organisations are receiving funding from lots of different sources for specific activities and running a huge amount of activities. And so some of those groups we work with to try and find coherency and really go back to the why do you need that data, who's it for, what are you going to do with it, rather than that responsive reactive, just collecting what the funder needs. And then with that, that's not useful for them for that data. So I guess my response to that is with those groups, we encourage conversations with the funders, like why do the funders need that? So it's great that Sarah's here, like why do the commissioners need that? And for the small groups we've worked with in the past, there was one particular case with a group in Newham, a newly started group in Newham, working with women and children in temporary accommodation. And they were setting up their frameworks for evaluating what they were doing. And they were under a bit of pressure to prove the health impact of their work. And they realised they couldn't collect that data without actually it being really uncomfortable for people coming to their services. So we had a lot of conversations with them about collecting data with dignity and what was appropriate to collect from very vulnerable individuals who they wanted to come back and use their services. So in the end, we worked with them with UCL PhD students who were involved, and we worked with them to create a comprehensive theory of change about their work, looking at proxies toward those impacts, also working with their beneficiaries to say what would be appropriate to collect from you and how we need this data. And they used that framework they developed to push back to the funders and to say, we can't collect this, but we're collecting this. And a lot of those conversations worked really well to say, well, why do you need that data? So I think just having those conversations and creating a culture around evaluation where it's not prescriptive, but actually really thinking and going back to the motivations behind it is really, really key.
I might just add to that, if that's okay. I completely agree with all of that. And it's, having those sensible conversations all round, I think, because, sometimes funders are more flexible than you think they might be. Sometimes they're not. But I was just going to mention that as part of my team at Anna Freud, we have the Child Outcomes Research Consortium, and a lot of what they do is working with, they work with the statutory sector as well, within schools, but definitely within child mental health services, but also with voluntary sector organisations, helping them think about what are the right outcomes for them. And sometimes that does mean involving outcome measures that are robust and are held in common, that don't feel like they're the most important thing, but they, you know, it has to be, we have to have something in common, right? But at the same time, helping them work from a theory of change. But we also developed a logic model, which actually is on our website. I think if you put in, it's the Evidence-Based Practice Unit logic model, EBPU logic model, I think, if you Google it. And it's just a very straightforward way of mapping out, you know, what's the intervention, who's it for, what outcomes will it achieve, how will it achieve them, will it work the same for everybody, those kinds of things. And we go through a process of sort of, it might be the same as yours, Gemma, but it's sort of mapping all of that out and then trying to rein it back in again to make sure it's something manageable. But those conversations can just ensure a clear shared understanding, and means that organisations like the Child Outcomes Research Consortium can say, oh, great, there's a good measure of this, or there's a, you know, because I think that robustness is important. It's not going to be there in every single measure, and youth voice is crucial, and that won't be, you know, that won't be a validated measure, but it will be a very powerful thing. So it's a way of combining all those different sources of information and making sure you've got the rigour and the measures in common, but you've also thought about your communities, you've given them a voice, and you've thought about their preferences, yeah.
I'm going to ask.
Thanks. Hello, can you hear me? Ruth Gilbert, UCL. It's a question about whether you're missing a trick on prevention for not taking a sufficiently coordinated approach to families. Many children with mental health will have parents who also have mental health problems, whether by common cause or by the because, you know, they're difficult to manage. And we don't have join-up between services to refer one to another or take a holistic approach to families. Can you suggest anything beyond family hubs, which are very much sort of early starting, but a more systemic approach?
Thanks for the question, Ruth. It actually put me in mind of, so when I was commissioning, I was in Camden, so on the patch. And one of the things that we did was work in collaboration with our two mental health trusts, the Tavistockers, the local trust providing child and adolescent mental health services, and Camden and Islington Mental Health Trust, who provided adult mental health trust, adult mental health services. And we work with CNI and their IAPT program, now would be known as Talking Therapies, to actually embed systemic adult practitioners in children's teams to work alongside children's mental health practitioners, both within the CAMS teams, but also within social care, within our disabled children's team, within some of our specialist school settings, to be able to provide integrated support, exactly because of the reasons that you were saying. You know, children don't experience mental health needs in isolation. It's part of a family system. And I know that there are some kind of parts of the system that do that really well. There are other parts of the system where that could be, you know, absolutely expanded. As you mentioned, family hubs are one element of that, but I think we need to be thinking systemically in terms of the way that we are delivering support across the pathway, and bringing much more of that work with families and children and young people together.
So I suppose this leads us on nicely to the next question, which is, I mean, it was going to be what are the most important gaps, but I've decided this is going to be a singular, it's going to be what is the most important gap in current mental health research and policy that research institutions like us can prioritize over the next 5 years. So you're forced to choose your favorite one. And Sarah, you are going to go first on this one.
Okay. Impact of integrated interventions. I think that we often look at interventions in terms of you know, the isolated, and I've talked a lot about the kind of integrated model of care and support, and I think having more evaluation, more research into that kind of shared outcome approach. We've been looking at it with the early support hubs. There's and I know the Fund the Hubs campaign have done some work at looking about integrated holistic support, but if we're talking about child-centred, family-centred support, integrated models of care need to be a key part of the model going forward. And I think we've got evidence, but I think how we bring that together systematically is really important.
Who wants to go next?
Shall I go next? My favourite gap. What's my favourite gap? I guess I'm going to pick up that point about research culture and research design and who's included in the research process, and probably point out the value of taking a more participatory approach to research, including young people not as participants in the research, but actually having a role in that research process itself. And I think there's some lovely examples at UCL and outside UCL where this happens, but we can do better at taking what we would call a more transdisciplinary approach. So not just research being held by the researchers, but involving policy, but also involving the young people, ultimately this where the interventions are trying to benefit as well.
Thank you. Jess?
I'm so glad I went last, because that means 2 things I would really like to see were already said. So I feel like I got 3 in 1, which is great. So given some of mine have already been covered, I think I would opt for the missed opportunity around linked data. And I know, thinking of Ruth particularly, but I know there's people who've been working really hard on how we can be more sophisticated but maximise the opportunity of administrative data. And it seems like such a shame that it feels so difficult to get some of our evidence-based, some of our data sets actually embedded within already linked administrative data and maximise the benefits as much as possible. And yeah, like I say, there's people much more skilled and further down the track on this than me. But I think if we could do that, that would be such a big win. And it's tricky because it's across systems, it's across silos, and it's around data moving hands, and you know how acceptable that is to those who have provided those data. But we've absolutely got to crack those things if we're going to get a really good preventative, 360-degree view.
So my last question. So somebody pointed out to me recently that nobody votes based on mental health. And the point they were trying to make is that the reason policymakers don't care about mental health is because us as voters never vote based on it. So my question to the panel is, what can we do to change this? How do we, increase, I suppose, how much people and then hence policymakers care about mental health? Sorry, it's a trick question, I know.
It is a really tricky question, because especially when you come from a perspective of feeling very passionate about something, you just like, well, just say it louder. But I think there is something about bringing some of the evidence to the fore. I mean, the economic case, as I sort of alluded to a bit before, is clear, and I think we have to keep reminding people that how much of a linchpin mental health is to everything else that comes afterwards. So that's secondary prevention. If we think about a person in front of us struggling with a mental health problem, they won't just be struggling with a mental health problem. If they're a young person, they'll be struggling to go to school, they'll be struggling with their friendships. They will not, they will be more likely to have difficulty accessing the work, entering the workforce. There'll be a whole range of things that become less likely or less positive looking as an outlook for those individuals. So if you can see mental health as that kind of embedded linchpin to everything else, it's kind of it unlocks a lot of potential if you can remove that distress or tackle that distress or even prevent it from emerging in the first place. So I think it's trying to get people to see that. I don't think that's an easy job, because we're constantly trying to justify focusing on mental health because of something else it can achieve. So for example, with the schools work, it is moving, but we used to have to say mental health is important because if you don't have good mental health, you won't get good exam results. And I got fed up of saying that. I just wanted to say it's important because it's just important. And so I think we have to be careful not to downplay it by justifying it through other outcomes, but the centrality of it needs to be emphasised, I think.
Thank you. Gemma?
Yeah, I guess when I saw your question, it made me think about the future and future policymakers and who they might be. And I guess I was thinking long term and about, again, if we centre young people's voices in this conversation, in the research, in deciding what happens, as storytellers about what their experiences are, they will eventually be, hopefully, the next researchers, the next policymakers, the next commissioners. And so that awareness raising comes from the ground. That was my hopeful, optimistic approach to your question.
Yeah. Really nice, thank you. And do you want to?
I was going to say, being on the inside of policy, it's a really difficult one, but I think I completely agree with both what Gemma and Jess has said, and I think that, we've got a real opportunity when young people are surveyed. Mental health and the environment are kind of two things that come up again and again in terms of, primary topics for them in terms of their interests. So I do think we have got an opportunity. I think that there's some really exciting discourse. I think we've got the opportunity to have quite a big moment, kind of publicity-wise this year. I know we have it's Mental Health Awareness Week next week and things like that, but actually there's some really solid work in the mental health space that's coming out, and I think we can really capitalise on that.
Thank you. Any more questions from the audience? Yeah. Mics are. Oh.
Hello. Thank you for insightful session today. I think today's topics are all interconnected. Like ultra-processed food and alcohol give us immediate pleasure, joy, just as nicotine of smoke provides temporary relief from anxiety. But both are giving us kind of vicious cycle. So I was wondering whether there is any research on healthier ways to tackle anxiety or depression, whether at a societal level or individual level. Thank you.
That's a big question. So what are the sort of evidence-based ways of tackling anxiety and depression that aren't the kind of quick fixes that make us feel good in the short term, but maybe don't work out in the long term? Is that yeah? Okay, good. There's evidence from a whole range of different arenas about what might be potentially helpful. So within the school setting, there's a range of universal and targeted interventions. And just recently, there have been some really nice ones, actually, that are a bit more sort of focusing in on those who might already be showing early signs of challenges. So Kathy Creswell, who's based in Oxford, has done what she called the ICAT study, where they have a nice app which is supported by parents, actually, using that with young people who already have anxiety, and that's been shown to be quite effective. The slightly older children, we've just had findings from a set of workshops called Discover, which is like a CBT kind of day workshop for sixth form age students that's been shown to be quite effective as quite a brief intervention. So those are two things sort of fairly hot off the press, so that's encouraging. And then there's a whole range of other things, isn't there? I mean, we know that things like exercise, we also know that we've, thinking about the prompt about thinking about family, supporting parents to support young people, but also tackling any parental mental health problems is also helpful. The NICE guidance would say that CBT, and that sort of middle range, the sort of mild to moderate, would be an effective intervention. I won't keep reeling off, but there's lots out there. I think it might be back to the point of there's lots we know. It's getting it implemented well and embedded well. That's probably more of the challenge. Yeah.
We have a question from online.
We have a question from Sabrina, who's joined us online, to all. What do you think are the main barriers to a holistic approach? Academic and governmental silos, career pathways, and self-interest, small-mindedness? Just suggestions.
Is each of those an example of the barriers? Okay. Maybe one barrier each.
Well, I think, definitely all of those mentioned potentially. I think that is, that was a bit my challenge about saying we need to step beyond our own favourite outcome. So, working at a mental health charity, I do have to step outside mental health sometimes and think a bit broader. But I do think the silos I find very challenging, and it's at national and local level. So I think there's a set of priorities that different people are working to, and it really prevents that kind of joined up thinking. It's been really nice to see the government missions as a means to getting sort of more join up. So it's nice to see that sort of thinking's happening. I would say that doesn't solve our problem about joining up outcomes, because they're all, uniting under one outcome. But I think the more join up and the more we try and break down some of those silos, the better. I'm not saying I know the answers, but I think trying to orient our behaviour to be working together makes sense. And things like pooled budgets and joint shared vision, shared missions do help.
Yeah, absolutely. I mean, we work a lot with Department of Health and Social Care. Obviously, we work a lot with Department for Education. Increasingly, we're working with Department for Culture, Media and Sport. We work with them really closely on the youth strategy. We've been working with DEFRA around the evaluation of green and blue social prescribing, and we've been working with DCIT thinking about kind of some of the online harms and social media and AI. So I think there is increasingly a cross-governmental approach around emotional well-being and mental health, and I think long may that continue. I think I mentioned it at the top in terms of the 10-year plan, calling out the role of the NHS in respect of secondary prevention, and I think it actually says, you know, something along the lines of the NHS in the past has shirked its responsibility, but it's not seen secondary prevention as the kind of responsibility of the NHS, and I think that provocation to us within the NHS that we need to think beyond secondary care is a really good starting point to go from.
It's a good question from Sabrina, because we've said that that's the need to work across sectors, to work together, to find that shared understanding or looking towards a shared outcome. I would say the barrier from my experience and my experience with colleagues working on lots of projects that have this aim of bringing together different disciplines or bringing together different knowledges is time. Like, you can get there, but it's the time needed to work together, to find that shared understanding, to understand different people's motivations. And a lot of time you don't have that time to do it because you've got to deliver on X, Y, and Z. But I think that's the main barrier, is allowing that time to build those relationships, to find the trust, to work out what you're doing together. And I've noticed that from the missions work. I was involved in the evaluation of the GLA's response to COVID, where they took this mission perspective. And it was a real push for them to change their working cultures internally, and they were straight on delivery, and there was just not that time to actually think about what was needed as an organisation to work across directorates. They're getting there now, like 3 or 4 years on, but it's taken that time to really work out how to work together.
I think one last question.
No.
No, we don't have one last question? Okay. No last questions. And
I'm so sorry, Praveetha.
No, it's fine. You have a better handle on the time than I do.
Thank you, Praveetha, and thank you, our expert panel. It's been absolutely amazing. So, pushing things along, sorry I have to do this, but with a great aim of celebrating our early career researcher network. And our ECN chairs are Louise McGrath-Loam and Peter Godolphin, and they're here, and they are going to announce the winners of the poster session.
Is this good? Perfect. Hi everybody, so I'm Pete Godolphin. Here with Louise, we co-chair the Health of the Public Early Careers Network. And we're doing a really fun job today of announcing the poster prizes. I thought we'd just spend 30 seconds telling you a little bit about the ECN first. So we basically organise events and networking sessions and try and signpost training opportunities for early career researchers across the entirety of UCL who are working in something to do with health of the public. So hopefully some of you here have been to some of our events or have heard about us. But if you haven't, we've just launched a new seminar series where we're trying to get people across different faculties talking about the same topic. We launched the first one last term, looking at AI and health, and we're going to be doing another one in the next couple of months, so keep an eye out for that. And there should be a newsletter which you can get hold of, look for it online, and basically should give you information about all of our events. Okay, so it's been really good today to see so many different posters downstairs across a variety of different areas And this year we launched a poster walk, and lots of you are attending it, and it was really nice to see all of that discussion and all the research that's going on from the early career researchers across UCL. So just before we move on to the winners of the poster competition, I just wanted to recognise the two winners of the abstract competition. Both of them have given talks today, so just wanted to say very well done to John and to Harry, who gave really good talks. So if everybody just... So now to the poster prizes. Oh, here we are. It's, so for second place, and you've already had a very brief preview of this based on one of the answers earlier, I would like to say second place was given to Kenneth's son. It's Kenneth here. So his poster was on who sees nicotine pouch adverts targeting an algorithmic reach or meta platforms in Great Britain. So massive well done, Kenneth. And then first place was Christina Skritska. Hopefully I've done that name okay. And her poster was on prevention through connection, enhancing the capacity of psychosocial care workers with practical, low-cost, culturally grounded tools. Massive congratulations. Thank you very much. There you go.
Excellent. Thank you. Good afternoon. So my turn to say a few words to round up the day. Congratulations again to the winners of the prizes. Fantastic to see both of the abstracts as well as the posters. Really great event. I'd like to start by thanking the Health of the Public team. Graham, Sarah, Rachel, as always, amazing job bringing everybody together to discuss the things that matter to all of us. I'm also delighted to see the range of topics covered today, from early in the morning when you covered obesity, Oliver's and colleagues' work and the panel and the conversations. I was privy to a meeting last year where they convened our community in this space, and you'd be filled with awe about kind of the evidence we generate and our impact on policy and the reach of UCL. It's also delightful to see the important conversation around alcohol and tobacco, both important topics about how we prevent them, how we tackle the ill consequences on health and well-being of alcohol and tobacco, and the very important discussion about the evidence on what we do to intervene here. And then this last session on mental health. Mental health is critical to all of us and the future of our society. Mental health and well-being, especially of kids, of adolescents, of children, is absolutely core to what we must do as a society if we are to have a bright future. So I was delighted to see the very healthy discussions and the fact that the panel was just enjoying their conversation, that Graham had to stop them from the fascinating topics they were covering. All 4 topics, so I'm on a Lancet commission that convenes the great and the good called the 21st Century Health Threats Commission, which Richard Houghton described as a commission of commissions, looking at every possible threat in the world that could face us in the next 75 years. We started from a list of 500 conditions, whittled out a few that perhaps we can't do anything about, such as an asteroid hitting the planet. It's the subject of this year's Lancet lecture, which you heard about. And when we whittled them down to just 17, all 4 topics you discussed today were within that 17 of the remaining threats facing humanity. So not only are these topics absolutely important for our health system and the evidence base created, relevant to the NHS and what we do as a society, but they are also important to global health and will shape the future of humanity. It is therefore absolutely right that Health of the Public is bringing the immense evidence that our community holds, the thought leadership that we provide across the board. I particularly liked the question earlier on about the intersection between all these threats. And if we are indeed a leader in this space, we should have also the intellectual space to begin to think the intersection of the various causes, because prevention, interception, or treatment of all of these conditions would happen, perhaps in the future intersecting all of them. And it's important that we have those conversations as well. I am clear that as the future goes, in my role as Vice Provost for Health, I want to draw on the strength of all our 11 faculties. It is therefore the reason why I'm particularly delighted that the health of the public portfolio has moved under my portfolio, and that our plan over the coming year is to strengthen the health of the public work even further, to increase its resources and its ability to convene our multidisciplinary strength across this university, to create the solutions that means we can influence policy better and that we can impact outcomes in the long run. And therefore, I'm looking forward to a very rosy future where we are more impactful on policy than we've been to date. Not that we have not been, we are amazing as an institution, but I think we can do even more than that, and I'm looking forward to that. I also want to appreciate our early career researchers, all of you in the room. It's absolutely amazing to see the posters downstairs and all of the things you're doing. Despite all of the geopolitical challenges and all of the pessimism that exists if you read the press, I am very, very optimistic that the solutions and a better future sits with you, and that you are going to be the ones that would shape a different future for all of us. So thank you very much for what you're doing. Remain committed, and we will address these major challenges that we all face. I know you have a reception coming on, so I won't stand in the way between you and all the goodies out there. Just to thank everybody for an absolutely amazing symposium, and I'm looking forward to speaking to a few colleagues before we all head off. Thank you very much again. Thank you.
Thank you, Ibrahim. And on our part, we're delighted to be part of the Vice Provost's Health Office. We think that that's going to be the way that we're going to better connect across the faculties. So just to end, it was Sarah Welcher, Rachel Hall and Fran Goodman who organised today's meeting, connected with all of the speakers, brought everything together, and they and a team of volunteers outside have made this possible today. So very warm thanks to them, please. Please do tell us what you think about the day. You can, using this code, be able to feed back to us. We'd really like to hear. We do listen. We want to make things even better next year, although today's success is so wonderful to see. And I think you've had enough being talked at. So please do some talking yourselves over some tea and refreshments outside. And many, many thanks to all of you in the room and all of you online for joining us today. It's been really, really superb. Thank you.